Hello and welcome to all of our Gold viewers today. I'm Fiona Langsharp, IBCLC and Director of Communications here and MC at Gold Learning. Welcome to our Gold Neonatal Online Conference 2019. We're going to be sitting down with Anna Axelin here today and chatting about what life is like for her in Finland. You can see on your screen that she's going to be talking about facilitating infant-parent closeness in neonatal care. No separation. I know she's going to be talking about it, so we'll talk about that just in a minute. But for you listening in right now, of course, quick reminder of what's coming up here. June 3rd, right around the corner here for everyone listening, and that is going to be a great day at Gold Neonatal here. We're going to have Nicholas Embleton coming up. He is going to be live, free, and open access. That's right, folks. This is going to be a free presentation. Don't forget that all of our keynotes, in actual fact, at Gold Learning, is we try to make sure that they're open access so that everybody can come and listen. Nicholas Embleton, who is back with us here by popular demand at Gold Neonatal, is going to be talking about probiotics in preterm infants. So that's going to be a great talk coming up on June 3rd. Also want to remind you that on June 24th is another open access and free presentation, and that's going to be with Karen Lasby as well. So do join us for that. You can go to the website now and have a quick look, goldneonatal.com. Bookmark that right now and come and join us for our Gold Neonatal Online Conference 2019. Well, let's get right to it here with Anna Axelin. She is here with us today from Finland. So excited to have you here, Anna. Welcome to Gold Neonatal. It's lovely to sit down with you today.
Thank you. This is absolutely my pleasure.
Well, I'm really excited, Anna, because you are speaking about not separating parents from their infants when there is, medical issues going on. And I know that this is going to be a great topic, but I know you're going to be exploring some details about perceptions and what that really means and all those outcomes and those types of things. So I know you're going to share a little bit about that in just a moment. But I do want you to share a little bit perhaps about yourself, and because you have been to different countries and lived in different places, but currently residing in Finland. So perhaps you want to tell us what it looks like for you there and what you do, on your regular day of work.
Okay, yeah, so I'm working as an associate professor and researcher at the university. So mainly I would say that my days are full of research. So in the morning we have meetings, what's today's research, and we try to try to find new questions to be solved, and like collecting data, analyzing, writing papers. And
right.
I would say that that's 70% of my day.
Wow. So it sounds really intensive, because for those of us who are not in research, you're looking over and over documents, trying to find things that are of interest, or your focal point that you have, your sort of highlight that you have focused on for that day. Is that correct?
Yeah, it is. And of course, it's a long process. So if you start something today, maybe in 5 years, you are able to see what came up. And then, yeah.
Yeah, and I laugh because it really does, this amount of time that it takes in research. And for those of us on the other side who just love reading the research when it's complete, we're truly grateful for those of you who love to be in the early and thick of things. So you have really so much patience, Anna. But you must also work with a great team of people too, because they're probably like-minded like you.
Absolutely, yeah. And so I have postdoctoral researchers here and PhD students, and also master students who are working with me. But I also think that the very important link for me is that I hope that I have time every week to go to clinics and see what's actually happening with nurses, doctors,
sure.
and parents. So that's the one source where we get our questions. And also because Finland is quite a small country, we are only 5.6 million people here. So that's why I collaborate a lot, like in international perspective, and have collaborators in several countries.
Yeah, and that's what it's about today. There's a lot of collaboration, it seems, going on, Anna, and it's so important now when we are looking at research to find out what's happening in other countries, because I think in some ways it helps us excel at what we're doing, and sometimes helps other people excel too. So that crossover of sharing information has got to have opened up a lot of avenues for you too over the years.
Absolutely, yeah, because when you are open to sort of explore and evaluate your own way of practice and share that
Mhm.
with the other people, so they can learn from you what is good in your practice, and also you can learn from other. And I think also when we are open how we are doing our current clinical work and our research, it also gives parents a possibility to sort of evaluate the different countries and units within them, so they have a really chance to choose the best ones.
Excellent. Well, thank you for sharing a little bit about that. Okay, let's dive into a couple of things that really piqued my interest about you, Anna. And that was in 2018, you were appointed as associate researcher at the Department of International Maternal and Child Health of the University of Uppsala in Sweden. So tell me a little bit about that. What does that mean?
Yeah, that's sort of like, how would I say, development over the last years, because I
Hmm.
have been thinking that I have learned a lot of like in a neonatal context in Europe and North America, but I was
Hmm.
wondering that could this, what we have found here and the research methods that we have developed, could they be any use in a low and middle income countries?
Right.
And that's why I moved to Uppsala, because they have long experience in the research in global health, and I went there to have mentoring and get new connections. And after that I have been now twice visited in Nepal, and
Right.
now we're looking more breastfeeding and skin to skin care and those kind of things in that context. So
Uh-huh.
idea was learn to new perspectives to this same
Right.
topic.
Oh, that must be very interesting for you. And just, it sounds like you're always on a trajectory of learning yourself as well. I heard you mention, to get more mentorship and those types of things. Is that something that you're very passionate about, Anna, as far as when you're learning and sharing with others?
Yeah, absolutely. Yeah, I hope that I'm able to mentor the younger, those who are coming after me. But I
Yeah.
also I'm all the time looking at like what the people are doing and what could we learn together. And the other important thing what I have been now focusing on learning is an implementation science, because we know that there is still a quite gap that if we find research, we show something that this would be a
Hmm.
good way to take care of the families. It usually takes 17 years to put that into practice. So
Right.
now in the future, I would like to learn more about the strategies and ways of working, how we could implement things to clinical practice quicker.
Yeah, absolutely. I know I hear this a lot. I hear 15, 17 years. And I think it's always extraordinary when I'm teaching students and I say those words. I almost don't believe myself. It's one of those things that we say that it almost
Mhm.
seems like, why are we still saying that, Anna?
Yeah.
That we haven't, we haven't got any further forward. But we're working hard at it. I mean, that's something that you're very focused on. But do you have these conversations with your peers as well?
Absolutely, every day, and that was actually the main reason why I decided, after being a neonatal nurse, which was the profession that I still love, but
Yeah.
there was every day a barrier when I suggested that
Right.
should we or could we do this a little bit different way. So then there
Hmm.
was absolutely no, that's coming too quick, and let's think about it. And that's why I took the research path and tried to understand better how to facilitate the change, because of course it makes sense not to jump to a new thing like without thinking, but yeah, there is also ways to facilitate that happening
Yeah,
quicker. Yeah.
absolutely. Yeah. Although, and that's good. And we need people like you and me who keep questioning that. And I'm sure our audience listening in too, they're probably shaking their heads because it's true. We need to make sure that we're implementing these things sooner because we have such great research today, and it's an area that's growing and expanding all the time, and it's exciting times, right? So that's good. Let me ask
Absolutely.
you, yeah, let me ask you a little bit about that. You are the lead on the Health in Early Life and Parenthood, which has the acronym HELP, so Health in Early Life and Parenthood, which is
Mm.
a research group, which says it aims to promote health and welfare in early stages of life. Tell me a little bit about that and how that was started.
Yeah, because my own background in clinical work is neonatal nursing. So basically, the idea was that already during that time, I learned that these things, they don't start when we are in a NICU, that we have to sort of engage the families earlier on, that we can prepare them, for example, for preterm birth or maybe even prevent that. So that's why after that, after studying quite much the neonatal care in an NICU environment, I have engaged in my research group also midwives, so we could
Hmm.
together, and gynecologist and of course neonatologist, that together as a multi-professional group we could try to
Right.
find ways to sort of take care of the families already when they are planning to having a baby.
Yes, because potentially there could be a role for every single profession that you mentioned in the care of a neonate, especially if it was a transfer or something like this. So I find this is so important that, you know, people can take on an individual role, but they are collaborating together as a team. It just makes a huge difference for families. And of course, the neonatal outcomes are better as well, of course, right?
Yeah, absolutely. It's shown in research that actually implementation is like more successful that when you are working as a multi-professional team. And I
Hmm.
want to take that same message to research because we are every day working in a semi-environment together. So of
Right.
course we share these questions and everyone's angle or perspective is needed to find like the best solutions to these.
Yeah, absolutely, absolutely. Okay, let's dive into this topic real quick here before we wrap things up. And I know I'm excited because you're going to be sharing this full presentation on June 10th. So I'm excited that you'll be sharing all of this. I can't wait to hear the full presentation because this topic to me, it seems, you know, when I say something like, Anna, it's a no-brainer that we should keep infant and
Mm.
parents together. But there are still barriers, and this is something I hope you're going to be talking about and why and the hows of what's happening. Can you share just a little bit of what you're going to be talking about?
Yeah, so mainly I sort of like try to first give you an idea where all those barriers can be,
Right.
and quite often we are not even aware of those. So these are some
Okay.
routine practices that we have been doing for several years, and it's good to question
Mhm.
every day what you are doing. And then also research provides us some answers how to facilitate and change our practices. What would be the good ways to move on, like single family rooms or couplet cares or so on.
Oh, that's exciting. And I know you used some of the language that I love in your abstract. So you can go and everyone can go and read, of course, Anna's biography and her abstract on our website at goldneonatal.com. But some of the things I love that you shared in there was things like patient-centered communication skills,
Mm.
parent autonomy. That's a huge one, isn't it, Anna? That's something that,
Yeah.
you know, we've started to really focus on because it makes a difference. When do you think that that started to become something that was, you know, we just want to continue to work with that sort of parent autonomy there?
Yeah, it's something that the parents have brought up in research themselves that they don't feel engaged before they have autonomy because the baby belongs to them. And if they don't have
Right.
autonomy to make the decisions, don't feel that they are part of the care. So I think
Mm,
we are some places we are good in that, but still there are areas like decision making related to care may be some of the things
mm.
that we could improve. Yeah.
Yeah, yeah. And I know when I talk with parents, Anna, they still do feel that sort of sense of helplessness, or they feel lost, or they're unsure, or they just feel desperate that they just want to turn their baby over to the care provider. You know, they just, here, just take my baby and fix him or her and make it better, you know, because it is so overwhelming for so many parents. But we want
Mm.
to see them involved. We really want to see them engaged because we know, again, when they go home, those babies improve better, and they, you
Mm.
know, overall the families do better long term, right, Anna?
Yeah, yeah, and absolutely, it's a development process. Of course, you cannot be necessarily engaged from the first second. Some parents are, but it's an individual process, and for some it might take longer than the others. But it's impossible if we, as a staff members, don't support that path and uh, like give parents an opportunity to get to know their baby and take more responsibility on the baby's care day by day. So I think that's a really big thing that we can
It's a
do.
big thing. Yeah, that's awesome. Well, I'll tell you, Anna, I have so many more questions for you, but I'm going to leave them for the day because I know I don't want to take up too much of your time today. And our audience listening in, I want you to come and visit, of course, with all of us here at goldneonatal.com. Thank you so much, Anna Axelin, for being with us here today. Lovely chatting with you.
Thank you for having me. Thank you.
And as I mentioned, folks, Anna's going to be with us live on June 10th. Now, go to the website, check your time zone. As I always mention, of course, it's going to be different for anyone. You can print out the schedule and have a look at it. You can register online at goldneonatal.com, and we'll look forward to seeing all of you there. Thank you once again to Anna Axelin for being with us here today, and we'll look forward to seeing Anna, of course, on the 10th. And thank you, of course, to our listening audience. Great having you all with us. Bye-bye for now, everyone.